Hey everyone, my name is Katie Edwards. I'm the Senior Medical Provider here at Trident, and today we're going to talk about how we can boost and improve our immunity and metabolism. So I like to give this lecture typically at the beginning of the year, because these are topics that are typically on our mind after the holidays, as we're making our resolutions, and as we're entering our winter months. So the goal today is to try to shed some light on why our body has changes in our immunity and metabolism, and what ways we can go about helping to improve those. So if you're listening to this presentation and it's not the new year, bear with me. But take yourself back to January 2nd, 3rd, and think about it. How were your resolutions? You sit there and every year we say it's going to be a new year, a new me. But what are you actually doing to make that happen? At that point in time, are you sick and tired of being sick and tired? Were your holidays extra good to you that you're having to compensate and really dig deep to make up for them? Well, let's talk about the reasons why. Weight management is simply a math equation. There is no fancy ways about it. So I laugh when I hear all of these crazy fad diets. And don't get me wrong, a diet is a diet, and if it controls your calories, you're going to lose weight. But the theories of how to eat and what to eat really boil down to calories. So weight management, again, is a math equation. It's how many calories you're putting in versus how many calories you're putting out. If your body is in a deficit of 3,500 calories, you will lose a pound of weight. If it's in an excess of 3,500 calories, you're going to gain a pound of weight. So it doesn't matter if those calories are Cheetos or if they're avocados, you're still counting calories. So the key difference and what changes the older we get is that middle variable, and that's our metabolism. So if it's that easy, you count your calories, you should be able to lose weight, right? Well, we all know that it's not always that simple. So when I asked a number of people, why is it so hard to lose weight? And when you break it down between the input and the output side, it really boils down to about the same things. Losing weight can be expensive. Gyms are expensive, diets are expensive, healthy food is expensive. It takes time. Exercise takes time out of that 24 hours you have in the day to do everything else. It takes time to plan your meals and to go to the grocery store. Good foods don't always taste as good as the bad foods do, so that's a deterrent. And when you're dieting and limiting calories, you're hungry. When you are getting home from the end of the day at working, you don't have a lot of energy to go to the gym, and sometimes you just don't feel like it. So those are all a lot of the battles that most of us struggle with in terms of losing weight. The time-trusted truth of, but I didn't always have these issues, comes up nonstop with my patients. And you're right, when we were younger, most of the time it was easier for us. And the reason is our hormones change. Now, most of us, when told the term hormone, we think of our reproductive hormones. So our testosterone, estrogen, progesterone, sometimes we'll come up with DHEA. But we actually have other groups of hormones that contribute to the same symptoms as well. Our growth hormone, our stress hormones. So we're going to break these down a little bit to make them make more sense and show how they contribute to our body as it changes the older we get. Before we get into what those hormones are, let's talk about why they change. So bear with me. If you've heard my caveman presentation, this is going to sound familiar to you, but I think this is an important concept to mention and to really hone in on when we talk about the aging process. So biologically, our bodies are programmed to be cavemen. So in caveman time, we were either productive to the tribe or we were surviving in the tribe. And men and women had different characteristics for these. So men, your characteristics were to be strong, fast, and to recover, because you were going to gather the food, to fight the dinosaurs, and to come back and recover and do it all again. So your hormones correspond to those symptoms accordingly. Women, our main goal was to be reproductive. We needed to be fertile. We needed to recover from pregnancy, and we needed energy to keep up with the cavemen and the cave babies. So our hormones corresponded to those characteristics as such. Now, after we were deemed no longer productive, and productivity again was defined by our ability to reproduce and to contribute to the popularity, we now just survived. So this is where men and women then became on the same playing field. Granted, this happens at different times in our lives. Guys, sorry, yours goes down a little bit sooner. But our goals for survival were basically to be warm, to be safe, and to be low maintenance, so we didn't take energy and resources from those who were being productive. So the things that contributed to that were fat, low metabolism, and more sleep. So that explains why after puberty and after we hit our reproductive prime, our body's priorities change. So in comparing these two times in our lives, you'll see those priorities we talked about are vastly different in our body. When we are children and teenagers, our body's main priority is growth. We're growing up, we're growing out, our bones are growing, tendons, ligaments, everything you can think of is growing. So that is the main focus of our body. Our activity level and our recovery level are pretty similar because, again, our body's main priority is the growth and not recovering. So that leaves us a little area for that fat storage or fuel storage in our body. Now, transition to adulthood, we're no longer growing. That's not our body's priority any longer. So most of that pie chart is now caught up with our fat storage because that growth sliver goes down so significantly. So why does this happen? So like we said, our hormones are changing. One of our major hormones that changes the older we get, in men and women both, is our growth hormone. So our growth hormone is a hormone that naturally spikes between about 2 and 4 a.m. So when we are in theory, our deep restorative sleep, our body is able to spike this hormone, which contributes to our ability to repair, recover, stimulates our metabolism, basically reboots our body in the middle of the night. The problem with this, again, is that it decreases the older we get. So after puberty, growth is no longer a priority, so our body's growth hormone decreases. Now, I'm not saying that I want us to continue to grow as adults, but the secondary benefits of the growth hormone, i.e. the repair, the recovery, those are things that we want to be able to maintain. So by reboosting the growth hormone, that can help our body to get back to the efficiency level that it once was. One of the ways we can do that is through peptides. So peptides, by definition, are just different combinations of amino acids. And amino acids, by definition, are the building block for every cell in our body. So if you take amino acids and combine them, you get peptides. You combine peptides, you get proteins. And proteins combine to form lean muscle. Now, lean muscle is important for a variety of reasons. So obviously it makes us look nice. Toned, lean arms and legs are something that I think a lot of us strive for. But lean muscle is what also surrounds our joints and ligaments. So that's going to help protect us the older we get in case we fall, in case we injure ourselves. It also surrounds our vertebrae. So it helps to keep our posture and our structural support of our spine. So different types of peptides are ipamorelin, sermorelin, and MK677. Now, most of us know our reproductive hormones. We have the estrogen, progesterone, testosterone, DHEA, but we also know that men and women have different hormonal changes. So I always like to compare these. So ladies, you can see we have a roller coaster of hormones that happens throughout the course of our life. In comparison to men, you're pretty straightforward. You will, however, notice that men's prime and decline are earlier in life, typically late 30s to early 40s, versus the female side, which can be as late as the late 40s to early 50s. So there is a significant difference in the time frame that these changes occur. Now, when we talk about treating these declines in hormones, you'll see this is where an inverse happens between the men and women. So the proclivity or the propensity of our body's relation to the hormones is different. Women, our bodies prioritize estrogen, progesterone. Men, yours do testosterone. Now, that being said, the symptoms that correlate to these changing levels are similar between the two of us. So testosterone in men and women contributes to our energy, muscle strength, muscle stamina, libido, recovery. Estrogen in both can contribute to water retention, sugar cravings, and mood swings. And DHEA is a sister hormone to testosterone and gets broken down into testosterone and estrogen. Now, the proportions it gets broken down to are different between men and women, but the similarity is still there. When it comes to hormone replacement, you treat the symptoms, not the numbers. And that's where a lot of people get caught up and have issues with hormone replacement, is they look at the numbers and not the individual. when you treat only the symptoms that you're having, your benefits are a lot higher and the risks are a lot lower. The third category of hormones that affect us are our body's stress hormones. And I think if we took a poll and asked if anybody had stress in their lives, it'd be a very high raise of hands. The difference in the way that our body responds to stress is in relation to the different types of stresses it encounters. So physical stress is going to cause an increased spike in our cortisol. So cortisol is produced by our adrenal glands, and those sit on top of our kidneys. And that's their only job in life, is to produce and regulate the amount of cortisol that our body has. So this really determines the way that our body fights or flights, if you take it back to that point in time. Homocysteine, on the other hand, is our body's emotional stress hormone. So this is the relation to our body's response to life and work and family and friends and finances. So again, there's typically a lot of that going on in our life. The difference between homocysteine and cortisol is that homocysteine can have a physical manifestation in our body outside that of the emotional side of things. It can actually cause increased plaque in the arteries that go to the heart, which is why stress can kill you. So I wish I could say that regulating your stress was super easy and that was the answer to everything. And although it's important to do and to think about, I don't think most of us have that ability at every given time. So one of the easier ways that we can decrease our body's stress hormone, particularly the homocysteine, is with B complex vitamins. So the B vitamins actually bind to the homocysteine, which then make it ineffective in our body. B vitamins are water soluble, so when anytime they're bound to something and our body's not using it, our body just excretes it. So decreasing the homocysteine will help significantly improve our energy, metabolism, and mental focus. Immunity is one of those things we don't often think about until we need it, aka when we're sick, or when we get sick and then can't get better and get sick again. Immunity is something that naturally exists in our body, but is directly affected by a lot of external factors: stress, germs, travel, hormones. So by looking at immunity, we can determine a lot about what's going on internally in our body. One of the ways that we can help to improve that naturally is through the use of an amino acid called glutathione. So glutathione is known as the mother antioxidant because that's just what it is. It's an amino acid that naturally decreases free radicals in our body. Free radicals are what our body produces anytime it gets stressed. So our skin gets stressed when we go out into the sun, our liver gets stressed if we have a cocktail, our brain gets stressed if we stare at a computer screen. So we all have a lot of stress that our body entails. So glutathione helps to decrease those, which boosts our immunity and helps our body to be able to repair and recover more efficiently. So I'm sure you're thinking, okay, this all sounds well and good, but how do I know if I need this? Well, the best way to determine that is based off of your symptoms and then to check your labs. So here at Trident, we do a very comprehensive lab panel that includes the hormones that we discussed today, our vitamin levels, blood cell counts, kidney level, liver function, thyroid, the whole 9 yards. So by looking at these levels, we can then come up with a customized therapy plan that's right for you. So please feel free to give us a call here at the office, 954-451-5454, or visit us on our website at www.tridentantiaging.com. Thanks for listening.